Three. 1, 2, 3. Hi guys, you're welcome. Hi guys, you're welcome to our live stream. Let me know where you're watching from.
CNA State Exam questions for our state. Pass your test. If you're watching this for the very first time, welcome to this channel, Nurse Pride, where you get to practice a lot of your questions, CNA, LPN, and so on. Please, if you find this video useful, please do subscribe, share, and comment. Let's get started. A resident from a cultural background different from the CNA's refuses a pork-based meal for religious reasons. The CNA should A. Explain that pork is a good source of protein and encourage the resident to eat. B. Apologize, remove the tray, and notify dietary to provide an alternative meal. C. Tell the resident it's the only meal available and they should eat what they can. And D. Suggest the resident pick out the pork and eat the rest of the food. What is the correct answer? The answer is B. This respects the resident's religious beliefs and right to make personal choices. The CNA should act to accommodate the request through proper channels. A resident with advanced Parkinson's disease is at high risk for A. Skin breakdown due to constant purposeful movement. B. Falls due to shuffling gait, stiffness, and postural instability. C. Dehydration due to excessive sweating. D. Weight gain due to slowed metabolism. What is the correct answer? The answer is B. The hallmark motor symptoms of Parkinson's is bradykinesia, rigidity, shuffling gait, impaired balance. Directly increases fall risk. Safety and fall prevention are paramount. A is correct. A resident family insists on performing a traditional healing ritual in the room involving burning herbs. The CNA should A. Allow it, as cultural practices should always be honored. B. Politely refuse, citing the facility's no smoking open flame policy. C. Report the request to the nurse so a safe compromise. Using unlit herbs, a ventilated space can be explored. D. Ask the family to leave if they insist on the ritual. Choose your answer. C is correct. The CNA balances respect for culture with safety and policy. The nurse or supervisor can work with the family to find a safe, acceptable adaptation that honors their tradition without violating fire safety. A nonverbal resident with advanced dementia is grimacing, rocking back and forth, and guarding their abdomen. The CNA should interpret these signs as A. Symptoms of boredom requiring increased activity. B. Probable indications of pain that must be reported. C. Normal behaviors for dementia and not a concern. D. Signs of hunger. The resident should be offered a snack. The answer is B. Changes in behavior, facial expression, and body languages are critical indicators of pain or discomfort in nonverbal resident. The CNA must report these objective observations to the nurse for assessment. When applying
Welcome live to our live stream. This on YouTube. If you're on YouTube, let me know in the comment section. Nurse Pride is an YouTube as a YouTube name. We're live on YouTube, streaming live from YouTube. Nurse Pride. I see Jareen, you're welcome. I see Laurie as well. If you want to see better, again, I'm just gonna post link to the YouTube here or the name just in case you want to be live on YouTube it as well. So the YouTube name is Nurse Right. Okay, 2026 CNA State Written Exam question and answer. We're gonna track our progress as well. The first 25 questions. After assisting with evening care, one second. After assisting with evening care, the nurse aide notices the client has bilateral hearing aid. The nurse aide understands that if a hearing aid is not in use, it is left turned on. B. The battery should be disengaged. C. It should be placed in the client's pocket. D. It should be left on the client's bedside table. What is the answer? All right, I see Grace Bamboo and I see Alicia. I see Grace. Everybody's saying I'm seeing B. I'm seeing C. And by the way, Happy Valentine's Day to everybody. So the answer is B. Like we're going to choose B. The answer is B. The reason is when a hearing aid is not going to be in use for several hours or overnight, disengage the battery to make it last longer. Equipment used to help the resident maintain correct body alignment includes all of the following except A. Bed cradles, cones, plinth, foot support. What is the answer? Again, I am alive both on YouTube and on TikTok. If you want to be on TikTok, it's fine. If you want to see the YouTube version, is way clearer. It's way clearer and visible. Everybody is saying the answer is B. Yeah, proper body position maintain good body alignment, which is necessary to avoid complication and help the client feel comfortable. Shout out to Alicia. Shout out to Grace. Next question. A nurse aide moves a resident's joint during range of motion exercises. If the resident complains of pain, what should the nurse aide do? A. Ask the nurse to administer pain medication so the exercises can continue. Push past the point that the pain occurs to see if it still hurts. Stop the movement at the point that the pain occurs and report it to the nurse. And D. Stop giving the resident any more range of motion exercises. I'm seeing what's your answer? Grace, what's your answer? Grace says C. The answer is C, of course. Range of motion exercises provide a way to maintain joint flexibility. ROM exercises will help prevent contractures, depression, pressure sores, obesity. What is the correct answer? If you're joining this live, happy Valentine's Day. I hope you had a wonderful Valentine's Day and you're back to your book to study. Please don't forget to like the video, follow, subscribe, and turn the bell on. We are practicing 2026 CNA State Written Exam questions and answers. Yes, the answer is A. The answer is A. A contracture is a shortening of muscles, tissues, tendons, and skin at the joint caused by lack of movement and exercises. A button hook and a sock assist are part of what kind of nursing care? Restorative and rehabilitative. activities of daily living, prosthetic mobility, disability, and reactivity. What is the answer? If you're on YouTube, that is how you see it. On YouTube, that is how you see the questions. That is YouTube right over there. What is the answer? I'm seeing C. Grace, Alicia. Someone says B. Remember, if you fail a question, you have to share the life with 5 of your friends. The YouTube name is. Let me respond to you, Sheila. The YouTube name is Nurse Pride. Let me see if I can respond to someone. Okay, I'm gonna write a comment. Nurse. Okay, I just pinned the comment so you can see it actually there. Yes, the answer is C. The answer is A, is restorative and rehabilitative. When clients are recovering from illnesses and accidents or learning to live with a disorder, special items can be used to help the clients adapt to the situation and be as independent as possible. The nurse aide is making an occupied bed. Which of the following is the most restorative approach? Which of the way is the most restorative approach? A. Encourage the resident to help. B. Lower both side rails. C. Do everything for the resident. And D. Tell the resident to get out of bed. The answer is A. The goal of restorative care is to enable a client to live independently and care for himself and herself. Even clients who must remain in bed can often still participate in their care. A patient has had hip surgery. Her legs should be abducted, elevated, adducted in the most comfortable position for her. I see Fardouche. This is A, all right? The answer is A, adducted. Following hip surgery, the client should be positioned to maintain natural alignment of the leg. A pillow, abducted pillow or wedge that is placed between legs keeps them in the correct position. Ankles and legs cannot be crossed. If you failed a question, make sure you send roses to those who are on TikTok and on YouTube. Make sure you just like the video, keep liking the video, and share it to your friends. Thank you. According to the principles of proper body mechanics, a nurse aide who is lifting an object should place his or her feet A. 3 to 5 feet apart, B. 6 to 12 inches apart. C. Anywhere desired. And D. 12 to 18 inches apart. I see Fadouche. I see Sheila. Sheila Durand. I see you on YouTube. Ladies and gentlemen, if you're on TikTok and you want to be live on YouTube so that you can watch live, I'm using my phone on TikTok. You can as well look at the comment pinned. The name is Nurse, lowercase, that's Nurse Pride. You can be with your friends right here. Okay. What's your answer? D? Yeah, I said the answer is D. Are you sure? The answer is D. When lifting any heavy object, start by placing your feet shoulder width apart 12 to 18 inches. A nursing assistant is helping a resident to walk. If the resident becomes faint and starts to fall, what should the nursing assistant do? A. Ease the resident to the floor and call for help. B. Haul the resident back to bed and then go for help. C. Hold the resident up and keep walking. And D. Hold the resident up and call for help. I see a lot of A's. I see Salima. Salimata. They say the answer is A. Ease the resident to the floor and call for help. Before helping any resident walk, take the time to assess how much assistance will be needed. Allow the resident to sit at the edge of the bed and dangle his or her legs before standing. A contracture, tightening and shortening of a muscle is caused by too much exercise, pressure on the muscle, lack of movement of the muscle, old age. Shayla on YouTube says A. Grace on YouTube says A. Fadu says A. Salima on TikTok, God's daughter says C. Sunshine says C. Salima says her answer is C. Okay, everybody is saying their answers are C. Let's go with C. Lack of movement of the muscle. When a muscle is not moved or exercised, it can shorten and become stiff. Range of motion becomes limited and movement can be painful. Prevention is important when a client is immobile and has a disorder that can lead to contractures. Next question. What is the process of restoring a disabled client to the highest level of functioning possible? A. Retention. B. Reincarnation. C. Responsibility. D. Rehabilitation. Keep sharing this live. Keep sharing the live. Keep sharing the live. The answer is D. Rehabilitation is a specialized care that helps a client reach the best possible level of function and independence. Question 12. A nurse aide just admitted a new male resident. Which of the following is the most restorative approach? A. Encourage a family member to unpack his clothes for him. B. Tell him he will need to unpack his clothes himself. C. Encourage the resident to participate in unpacking his clothes and D. Unpack all his clothes and put them away for him. Someone said the answer is C. Restorative care helps a client regain the highest possible health and function and helps them prevent decline. If a client has hand tremors, the nurse aide should A. Tell the client to stop shaking and to control the tremors. B. Assist the client with the activity of daily living as needed. C. Restrain the hand that has the tremor. D. Do everything for the client to avoid embarrassment. I see Grace, I see Fadush, I see Salima, I see Shayla. Don Baba, thanks for the gift. I want to appreciate everybody who is sending in roses. If you're joining this live for the first time, my name is Dwayne, both on YouTube and TikTok. We are doing a CNA State Written Exam for our state. We also do NCLEX for LPN as of now, but the time is usually before the CNA on. The time is usually 6 p.m. Pacific time for NCLEX PN and 7 p.m. Pacific time for CNA. The answer is B. Hand tremors are the most common type of involuntary movement. Your hand is shaking. There is no cure for tremors. Treatment includes physical therapy, occupational therapy, medication. Goals for arthritis care include strengthening bones and muscles, decreasing inflammation and preserving joints, preventing contractures. D. All of the above. The answer is all of the above. The primary goal of restorative care is A. To restore the resident to a normal life at home. B. To do everything for the resident. C. To take care of the resident's personal business. And D. To keep the resident comfortable in the nursing home. The answer is A. How can you give a helpless resident some independence when he or she must be fed? A. Always stand to feed the resident. B. Ask the resident which food he or she would like to eat. C. Feed the resident with a fork. And D. Feed the resident lying down. The answer is B. If a resident is dependent on staff for total care, try to find ways to give the resident a sense of control. The most basic rule of body mechanics is to A. Never use a lift belt. B. Bend from the knees and hips. C. Keep the arms flexed. And B. Twist as you lift. I see you, Alicia. You have to bend from the knees and hips. I see you, Shayla. I see you, Salima. I see you, Fadoush. Say, Mr. Johnson has just returned from surgery. Which of the following things do you do? A. Check vital signs every 4 hours. B. Perform turn, cough, deep breath, and leg exercises. C. Notify the family about the results of the surgery. And D. Immediately give medication to control nausea. The answer is B. When ambulating an unsteady client, it is best for the nurse aide to use a wheelchair, gait belt, squat cane, walker. The answer is what? B. Pressure sores can often be prevented if the client is placed in an incontinent brave position with a pillow under the head, turn or reposition every 2 hours, dressed in loosely fitting clothing. The role of an ombudsman is to control the nursing home budget, to run a group of nursing home, to prepare classes on client hygiene that nurse aides take, to work with the nursing home to protect clients' rights. If you're watching this live from TikTok, we are also live on YouTube. We are 4 questions left to finish the live on TikTok, and we'll continue on YouTube. So if you're on TikTok, I will send you the link to continue with us. Now, what's the answer? D. Yeah, D is the answer. The nurse aide documents that about 45 minutes after the resident was put to bed for an afternoon nap, the person urinated in bed. To help with bladder training, what should the nurse aide do? A. Remind the resident that it is important to cooperate with bladder training. B. Take the resident to the bathroom after he or she has been in bed for about 30 minutes. C. Take the resident to the bathroom right before he or she goes to bed. D. Report to the registered nurse that the resident will not succeed in bladder training. This is question 22 of 25. The answer is C. You are delegated to provide passive range of motion to left, lower, and upper extremities. This means you must A. Watch how many times the client moves left, lower, and upper extremities in 15 minutes. Support each joint and provide extension and flexion movement on the side of the body. Have patient raise arms and leg arm and leg 10 times. In D, extend right arm over the left side of the body. Answer is B. A patient is leaving the hospital. The family has been told to give our medications BID. The wife asks what that means. The nurse aide tells her to give the medication once a day, twice a day, only when needed, 3 times a day. BID means twice a day. Exercises that move each muscle and joint are called adduction, abduction, rotation, range of motion. Range of motion. You have passed this exam with 92%. We are going to continue. Why did this just start? A second. All right, if you are, I'm live on YouTube. I just want to go to the next one. I'm sure the paid version just left. I'm going to go to another paid version. So if you're on TikTok, you want to go on YouTube right now, I'm about to open the next step of the test. So you can go to the YouTube channel. The name is Nurse Pride. Let me write the name here and pin it in the comment section. Most weekends we'll be going live on YouTube. Well, you see that on YouTube is clear, and also we can do a lot of things on YouTube without TikTok telling us some things like maybe have your life. And so um let me go to the next one first. The name of the channel is there. I just pinned it already. You guys can follow me. I'll be resting on YouTube for now because um holding the phone in my hand. By the way, I told you guys that for weekends we'll be dwelling so much we're dwelling on YouTube. Where's this one in there? Where's this exam? CNA State Written Exam. Okay, I see everybody joining. If you're here, join on YouTube. Let's go. Join on YouTube right now. I am setting the test for us to start. I'm about to set it. If you don't see me live on TikTok, you see me live on YouTube. Okay, guys. Shout out to everybody joining us now. We are live on YouTube. Let me share the next one for us. Let's do prometric exam, prometric practice. Okay, this one is awesome. Let me show the screen to this one. So we have, you see here, we have activity of daily living. We have client rights. We have emotional and mental health needs. We have member of a healthcare team, spiritual, cultural, this basic nursing skills, communication, legal and ethical behavior restorative. Now, in your CNA exam, state exam, you have this one is about 20% of the exam. A lot of question comes between basic nursing skills, activity of daily living, infection control. So you want to master this one a lot. That's why you see there's 40 questions only in basic nursing. You'll be tested for this. Someone say, what's your YouTube channel name? It's Nurse Pride. Let me respond to you. Reply, Nurse Pride. So guys, follow me on YouTube and let's run this one. Follow me on YouTube. Let's run this one very quick. I see everybody joining. Um, Vera Sheen as a sing. Thank you. Nobody's going to fail. I think we've received about 10 people who have recently passed their exams. And all it takes is just practice, to be honest. You just have to practice. Practice every day, 1 hour of intense practice, live simulation of CNA state exam. If you have someone who is in the CNA class or who is thinking of getting into a CNA school, please share them this live, share them this channel, as well as nursing school for LPN. We'll be doing NCLEX for LPN as well too, for practicing. We can use ATI, have a bunch of ATIs and other ones. So please, let's get started with basic nursing. That one, of course, we have a lot there. Okay. Let me set this stuff there. Well, okay. So let's go. Question one. I see you. Send me the link, brother. Okay, let me send you the link so I can share with your friends. I'm gonna share the link on right in the page right there. Let me paste the list. The link right there. That's the link. You can share the live with your friends, okay? If you are live, you can see way better. If you're on TikTok, we just have 5 minutes to exit TikTok live. We'll be live on YouTube. Okay. We have a lot of things to cover. My hand is really paining holding my phone. So if you're on TikTok, please head to YouTube very fast. We only have 5 minutes to be on TikTok and we're going to continue live on YouTube. Okay, let's continue now. To obtain the most accurate patient weight, the nursing assistant should weigh the patient A, 3 to 4 hours after eating at the same time every day, B, directly after a meal, and D, with two different scales. I'm seeing a lot of B's. The answer is B. Let's check answer. The answer is correct. Weighing the patient at the same time every day will yield the most accurate result as the patient is likely in similar circumstances. Stop that. I should do that. Number two. A nursing assistant is instructed to take the oral. Someone said, what's a YouTube channel? Let me reply, mother. YouTube. A nursing assistant is instructed to take the oral temperature of a patient who has just had a cold drink. The patient's temperature should be taken 15 minutes after the drink was finished, 20 to 30 minutes after the drink was finished, 3 to 5 minutes after the drink was finished. Immediately, a cold drink should not affect the reading of most modern oral thermometers. I see Fadush on TikTok, on YouTube, uh, Viraj, Trump, Osiri, or Salima, Princess Mane. I see your answer. It says A. I'm seeing A, I'm seeing B, I'm seeing A. The answer, let's check the answer. The answer is incorrect. All of you said A. Put your hand up. The answer is 20 to 30 minutes. A nursing assistant is caring for a patient with MRSA and is wearing a gown and gloves whenever she provides the patient care. When she needs to go care for another patient, she should dispose of her gown and gloves in the dirty utility room, in the current patient's room, in the next patient's room before touching that patient in the hallway. For those of you on TikTok, you have just 2 more minutes. I'm going to turn off TikTok live because we have said that on weekends we'll be doing live on the YouTube. Okay. If you know my YouTube name, it's Nurse Pride. Just follow me. If you check my story on TikTok, I updated it this evening. What's your answer? I see a lot of B's. The answer is B, correct. Another term for decubitus ulcer is pressure sore, perforation, ulcerated tumor, ulcerated cyst. One minute for those on TikTok. Muy bienvenidos, José Laprado. Muy bienvenidos. ¿Cómo estás? Bienvenido, gente vivo. Estamos en vivo transmitiendo los exámenes de CNA 2026. The answer is A. Is it A, B, C, or D? I see Nodalmas for YouTube. Gray says it's A. We go with A. YouTube people say it is A. TikTok, what y'all saying? When monitoring a client's temperature, which thermometer would provide the least accurate reading? Tympanic, rectal, oral, axillary. Vera said it is A. They said the least accurate reading, not the most. Something says C. Gray says B. I see a lot of B. Recta is the most. They said the least. The least. Let's check D. The answer is D. Give it up for Zoe. Give it up for all those who said D. There were a few of them. All of you who failed it, meet me on YouTube. The least is axillary and skin thermometer readings are the least accurate among temperature devices. The most accurate thermometer reading will come from a rectal thermometer. Okay? When transferring a resident from a wheelchair to a stationary chair, the nursing assistant should stand behind a wheelchair in front of the wheelchair to the left of the side of the wheelchair to the right side of the wheelchair. Okay, ladies and gentlemen, to those who are on TikTok, thank you very much. I'm very sorry, my hand is really paining. We are all live on YouTube. You want to join us? Just follow me on Nurse Pride on YouTube. I've already posted the link so many times on this live. Catch you guys on TikTok. Thank you. Want me to post the link? Oh yeah, post the link. Okay, let me go get the link and post it. What's the answer? Everyone on TikTok now. I'm on YouTube. My people on YouTube. Let's go. Let's go. Let's go. Let's go. Let's go. Let's go. I'm posting the link and I've posted the link. I don't know if you can copy the link on TikTok. You can copy and follow. Pin. All right. People say it's you said it's B. You say someone say it's C. Someone say it's B. B. Okay, let's check the answer. We are live now. Everybody from TikTok will meet us on YouTube. Okay, the answer is correct. We move to the next one. Which of these could be considered neglectful when assisting a resident with showering? A. Respecting the fact that bathing and showering can be a scary activity for residents and assuring them you will help them through the process. B. Being sensitive to water temperature and testing it before beginning the procedure. C, being patient and calm, explaining what you are going to do before you do it. And D, leaving the resident alone so they are motivated to care for themselves. What's the answer? I see a lot of B. I see a lot of C. I see Brian 23 says D. Natasha says this C. Princess says this it is B. Let's go again. If you fail the answer, you just gotta send a lot of likes. Now here you only have to share and like. You can't give gift here, so it's fine. Let's go with D. The answer is D. Residents left alone in the shower could slip and fall. A resident suddenly complains of chest pain and shortness of breath. What should the nursing assistant do first? A. Call for the nurse or emergency help immediately. B. Encourage the resident to take deep breaths and continue with the activity slowly. C. Leave the resident alone to rest quietly. D. Help the resident lie down flat and give them a glass of water. What's your answer? I see A. Okay, let's go with A. A lot of people are saying A. Good. A is correct. Chest pain and shortness of breath are possible signs of a heart attack and another serious cardiac or respiratory emergency. So that's great. All of these are ways to prevent pressure sores except A. Avoiding wrinkles in the sheet, changing soiled sheets quickly, providing extra blankets, changing positions regularly. Thanks for the likes. Thanks for sharing the likes. I see ya. I see ya. I'm seeing C. Answer is C. Answer is C. Which of these describes stage 4 of a decubitus ulcer? Superficial ulcer that looks blackened or like a deep crater. Open area with redness. Open area with damage reaching to the bone, joint, and tendons. Redness on the skin. If you're a nursing student, you're going to answer this one. Bether Masoka says, I have the exam at 12:30 a.m. Good luck to you. Good luck, good luck, good luck. We're wishing you well. Good. I see a lot of C's. The answer is C. When you see the bone, the joint, that is definitely stage 4. Damage to the bone, joint, and tendon signal stage 4. Stage 1 is redness. Stage 2 is both redness and an open sore. Stage 3 may indicate a blackened and crater-like appearance. Which medical term is used often for burping, birching, and passing gas? Familiar, flang, fascia, flatus. I see Gilbert Zhang, Nordal. I'm seeing A, I'm seeing B, I'm seeing C. It's D, flatus. The medical term for intestinal gas is flatus. Making a bed, whether occupied or unoccupied, should end with A. Adjusting the height of the bed, washing your hands, metering the corners, moving the collar. The answer is washing your hands. Which of these is least likely to contribute to skin tears? Length of hair, resident falls, equipment, length of nails. Gemini says B. Nolda says D. Princess Manny says A. Salima says A. If you're watching me on YouTube, don't forget to subscribe and you turn the notification bell. It is so that when we are going live, you'll be notified that we are live, okay? B. The answer is length of hair. Which of these is least likely to contribute to skin? So we failed this because we didn't understand the word least. 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 The answer is A. Briar, you had it correct. I think I've seen only Briar having this one correct. Which of these treatments will be best to describe swelling? The answer is A. Cold compression. Which of these is the least likely to signal impending death? Least. The key word is least. Increase in appetite, labored breathing, unstable blood pressure, cold extremities. What's your answer? The answer is A, correct. Which medical position can be described as the patient's head is elevated with legs either bent or straight? Fowler's position, Trendelenburg's position, Sims' position, Rowe's position. Fowler's position. Which of these examples demonstrate using proper body mechanics when helping to lift a resident in bed? Bending at waist, kneeling partially, flex using leg muscles to lift, bending at waist, knees unlock using back muscles to lift, bending at waist, knees unlock using arm muscles to lift. Which one is correct? A. Okay. We're going with A. A is correct. Next question. The best use of alcohol-based sanitizer is when hands are visibly soiled, when helping a catheterization, when hands are not visibly soiled, when hands have blood from a cut. What's your answer? I'm seeing C. I'm seeing B. I'm seeing D. D. Carr says B. Gilbert says it's D. Salima says it's C. No Dadalma say it's C. I'm gonna go with higher than more of them. I think all of you are saying C, C, C. Let's take C. Let's take C and C. Let's check C. C is correct. C is correct. If you didn't have C, I'm sorry, you failed it. Which of these is incorrect in reference to wearing gloves? Peel the glove away from you so it comes off inside out. Wash your hands before putting on and after removing your gloves. Upon remover, avoid letting the outer layer of the gloves contact your skin. Always wear latex gloves because they are the most impermeable option. Ladies and gentlemen, we have 2 minutes to end this live. We've been live for more than an hour, 20 minutes. Live from California. Two more questions will be out from this live. Two more questions. I will continue tomorrow. Now let's go with this last one, guys. Fam, let's go with this last one. Then we'll continue tomorrow, okay? This question 20. We'll continue tomorrow from 21. So we go with this last one. If you are walking with a resident and they fall, which of these is not an action you should take? A, B, C, D. Drop your answer in the chat and let me know where you are connecting or you're joining us from. I'm streaming live from California. Yes, sir, the answer is what? C. The answer, the answer is B. All right, guys, thank you so much. Thank you guys so much.
Exam questions for our state. Pass your test. Professor can work with the family to find a safe, acceptable adaptation that honors their tradition without violating fire safety.
Salima, the question about gloves, it says latex. Latex is a special blue gloves. That one. So it is expensive though.
A nonverbal resident with advanced dementia is grimacing, rocking back and forth, and guarding their abdomen. The CNA should interpret these signs as A. Symptoms of boredom requiring increased activity. B. Probable indications of pain that must be reported. C. Normal behaviors for dementia and not a concern. D. Signs of hunger. The resident should be offered a snack. The answer is B. Changes in behavior, facial expression, and body languages are critical indicators of pain or discomfort in nonverbal resident. The CNA must report these objective observations to the nurse for assessment. When applying a warm compress for a resident, the CNA must always A. Apply the heat source directly to the skin for maximum effect. B. Check the skin for redness every 5 to 10 minutes and limit applications to 20 minutes. C. Use a compress as hot as the CNA can comfortably tolerate on their own wrist. D. Secure the compress slightly with tape to ensure it stays in place. The answer is B. These motors for burns, especially in the residents with decreased sensation, and follows the time limit to prevent tissue injury. A is dangerous and can cause harm. C is unreliable. Many residents have thinner and more fragile skin. D can impair circulation and cause injury. When finding a potential sign of physical abuse in an elderly resident, which finding? A bruise on the outer right arm from bumping into a door frame. B. Multiple bruises in various stages of healing on the inner arms and torso. C. A small fading yellow bruise on the left thin. D. Skin tears on both forearms, a sign consistent with fragile skin. The answer is B. Bruises on areas not typically injured in common incidents. Inner arms, torso, face, back, especially in various colors, indicating different ages, are suspicious and warrant further investigation and reporting. A resident family member frequently yells at the resident and threatens to withhold visits if the resident acts up. The CNA should recognize this as a normal family dynamic under stress. B. Acceptable discipline for a dependent adult. C. Potential emotional or psychological abuse. D. A private family matter not requiring intervention. C is correct. Verbal threats, intimidations, and manipulation that cause emotional distress constitute psychological abuse. The CNA is mandated or a mandated reporter and must document and report these observations. The safest way to move a resident's wheelchair down a ramp is to tilt the wheelchair back and pull it down the ramp backward